Good evening, and welcome to Health Plus Weekly. I am Dr. John Podkowa. I'm joined by our co-host, nurse practitioner, Hannah Raymond, and we are excited to welcome you back to the show. We hope everyone's having a great fall. It's hard to believe the month of September is nearly at its end here.
Amen.
And Hannah and I are excited for a great show tonight. This is our last show that Hannah and I will be doing for a little while. We're taking a break, and so we thought we'd kind of start where we began in talking about primary care, ways to stay healthy, and recapping kind of a great year and a half on air and some of the guests we have had the privilege of interacting with.
And some of the highlights of the wonderful resources we have in the Southcoast community.
Yeah, we want to make sure that people still have just a recap of all the great resources that we have available in our community. As always, we love to hear who's watching, so please let us know, who and where you're watching from. If you have questions regarding general internal medicine, the topics we're talking about, please feel free to send them in via Facebook, and we'll try to answer them as the show goes along. We love hearing from you and interacting with you. And stay tuned, even after tonight's show, that we look forward to working with the marketing department of Southcoast and New Bedford Guide for other good content. So this is just a bit of a break, but there'll be more great things coming.
A couple things in October to stay tuned for sure.
Yeah.
So.
So we, kind of the premise of the show, and certainly of primary care, is preventing disease and staying healthy and wellness. And so just in the beginning, we just want to remind people that there is so much we can do to control our health and prevent disease and promote wellness.
Outside of the doctor's office, you don't need to be seen by anybody. You can do it at home. You can do it on your own. And there's just a whole host of things that you can do on your own to stay healthy.
Yeah.
I know that you talk a lot about the blue zones. Do you want to describe a little bit about what that is and kind of the...
And so, there's this, these pockets of the world where people live longer than anyone else in the world. And not only do they live, really healthy and well and are active. And there's people study them and they have common habits. And so what are some of those habits? They are, first and foremost, they're active. They stay active in their lives. Some, do via regular formal exercise, many others in other countries just via the way they work and live. They stay lean, kind of keeping a normal body weight and watching your diet is super important, we know, in terms of preventing heart disease, cancer, joint disease, diabetes. And so we'll talk a bit about that. Not smoking. Really important.
A lot of them are plant-based diets as well, leaner meats, a lot of vegetables, a lot of fiber and beans too in the diet.
Anyone who's been watching the show for a long time knows I'm a proponent of a kind of a heavy plant-based diet. But in addition to that, there are other diets that are super successful for people, and so we encourage you, and if you have questions about that, we'll mention in a minute, but we have a great nutrition program at Southcoast where you can get connected if you have questions. Limiting alcohol intake. There is, kind of increasingly good evidence that alcohol, unfortunately, is not good for us. It can lead to kind of a host of, diseases, including liver disease, more and more cancers. So kind of minimizing the alcohol intake in your diet.
So the recommended alcohol intake for men now is less than 2 drinks a day, and women is less than 1 drink a day. But as you said, there's new kind of emerging data that the less alcohol you take in, the better in terms of your overall risk for, preventing disease in the future.
Other habits that these people who live in the blue zones have is they have hobbies, so it's really important to kind of find things that you love and enjoy. Being surrounded by family and friends and having purpose in your life is really important. There's actually great data that taking someone into your house or caring for a family member and extends your length of life for them.
So we actually, Dr. Michael Rocha just tuned in. So hi, Dr. Rocha. Kind of while we're talking about the kind of perfect segue into talking about other things that you can do to help stay healthy, help prevent disease outside of the doctor's office. He did a wonderful presentation on the show about mindfulness. Yeah. As well as Dr. Sani. Yep.
Which I think it's really great that 2 cardiologists are, outside just the realm of the heart and kind of approaching it from a non-traditional way. So. Yeah, so mindfulness, just to a simple way to remember, just being present now, kind of the past is behind you and, we're not sure what's around the corner, and just really taking a minute to just enjoy right where we are. And we can do that as simple as a breath. But Dr. Rocha and Dr. Sani's show also talked about some other activities of kind of being here in the moment, which is a little
bit of meditation.
Yeah.
Tai Chi, whatever it takes, and positive effects on lowering blood pressure, lowering stress levels, and kind of all the good benefits that come from that as well. We have another shout out from Sherry saying,
"Oh, hey Sherry."
And Sandy's watching as well. So hi everybody. Thanks for letting us know who's tuning in and where you're watching from.
And Dr. Rocha and his always great work with the New Bedford Wellness Initiative has been amazing in terms of raising awareness of kind of healthy living, healthy eating choices, exercise. His walk with the doctor, or the New Bedford Initiative's walk with the doctor, happens every Saturday. I'm actually really happy to be doing it this weekend. So Buttonwood Park, Saturday morning. If you want to come down, I'll be there walking with people. Thank you, Dr. Rocha, for including me in that. Heather Haynes and our nutritionist who came on several times, we want us to make sure we thank, again, the guest as well. Thank you very much. Just remember, if you have more questions about nutrition, you can work with your primary care doctor to get referred into our Southcoast nutrition clinics, because they're really, really helpful. And the good news is that insurance is wising up that how important food choices are towards health, and are covering it. So please don't forget about that.
And it's young, old, underweight, overweight, specific diets for heart disease, for diabetes, peripheral vascular disease. So pretty much any question you have about nutrition or diet. And sometimes people they're healthy and they truly want to prevent disease. And so they'll say, I just don't know the right thing to eat. And so they don't have any problems yet. And that's something we can do too. I have referred people as well to the nutrition.
Absolutely. I mean, there just has not been a really great way to get education on food and nutrition and how to read labels and things, so we can help with that because it's really important.
A couple of other shout outs. Maureen is watching. Grace is watching. Hi, Grace.
Hey, Gracie.
Taryn's watching.
Hey, Taryn.
Do you want to stop for a couple questions now while we're about diet?
Sure.
There's one about from Karen asking about the ketogenic diet, which I know that we spoke a lot about with Heather Haynes.
Yeah, really popular right now.
Yep. In a nutshell, it's eating foods that keep your body in a state of ketosis where you are burning
certain type of metabolism.
Yep.
Yeah.
Yep.
And kind of a low carbohydrate diet. It is not, right for everyone. This is definitely a diet that we would strongly recommend you talk to your healthcare provider about in terms of whether it's a good or not, a good diet for you or not, because it's not right for everyone. There's been, we have many patients who have been successful on it and done great. And I think it's important with those type of diets to make sure that it's appropriate for you. Make sure you're monitoring your liver, kidney function, and cholesterol because they can be altered on it. But certainly a successful, popular diet right now.
And a lot of times it's a good jump starter for people too.
Yeah.
It may not be sustainable for the long term, but in terms of sticking to something, seeing results, and then kind of gradually having a little bit more of a liberal diet, that can help it there. So we have Kathleen watching and Sue Sherman watching, who was one of our wonderful physical therapists.
Yes, absolutely. So when we start moving and exercising, again, if you pull it back or a hamstring muscle or get yourself in trouble, we have great services in terms of our providers and also our physical therapy and resource departments.
Right.
Brain and spine. So it doesn't always go, unfortunately, well, I've hurt myself a couple times training for, a couple of years ago, I was training for the Boston Marathon the first time I ran it, and one of our physical therapists, Darnell, really got me kind of back up and running and helped me finish the race. So our physical therapy department's remarkable.
We also have a question from Kaylee about what do we know about pseudotumor cerebri and can it affect your eyes? She was diagnosed by a neurologist, but it was never communicated with her new neurologist. So do you know anything about that?
So I know a bit. I mean, so it's a serious disease that you have to kind of follow and keep track of. We don't see a lot of it in primary care. Headaches are often associated with it. Can cause vision changes. It has to do in terms of pressure in the brain, and there's certain reasons why it could be caused and medications to manage it. I would definitely. It's not something you want to kind of let go. Yeah, that to continue to follow up in coordination with. Your primary care doctor, probably an ophthalmologist, and neurology is typically who our patients kind of triangulate with.
Right, okay. And Kim actually commented that she also heard that the DASH diet was a good one too.
Yeah, absolutely.
So that is a fantastic diet for a lot of different, preventing a lot of different diseases. And when you think about really any healthy diet, if you're trying to prevent high blood pressure, high cholesterol, or diabetes, they kind of take on the same or similar kind of makeup on your plate. In terms of keeping yourself healthy too, when prevention and screening we move into,
Really important that we know our blood pressure, right? The DASH diet, it stands for the dietary approach to stopping hypertension. And so blood pressure, unfortunately, a silent killer in a lot of ways. We often don't know when our blood pressure is high. So for people watching tonight, if you're not routinely plugged in with a primary care doctor, which we definitely think you should be for a variety of reasons. But one is blood pressure. You may not know it's high, and it can do damage on your eyes, on your brain,
kidneys,
your kidney function. So
and your heart.
Yep. And then, again, things that you can control in your own life in terms of, keeping your blood pressure in check. It's a big part of his diet. So watching how much salt is in your diet, and also kind of keeping food rich in potassium in your diet, because we know that helps with blood pressure.
Another big thing that we talk about in terms of prevention is not smoking. We did almost an entire show on how to quit smoking, kind of the immediate benefits of if you are smoking, once you stop, how the positive effects for your body are really almost immediate and just continue to grow the longer that you're not smoking.
Yeah. And we know it's not easy, it's extremely addictive, but there is really good, things we can help people with, or that to make it, to make the so the nicotine dependence better, and that people get discouraged, they try to quit, and then they go back to smoking. But the reality is, the more time people try to quit, the more likely they are to quit. So kind of keep it up, picking a quit date. Talking with your, doctor and nurse practitioner about, nicotine replacement therapy, whether it's patches and gum and some of the medications we have, it just really increase your odds of success and maybe make you a little less miserable for the people around you as well.
And there's QuitWorks as well, which is the online resource, through the state of Massachusetts. And I think it's pretty much every state in the nation. And so that's available online if you just Google
1-800-QuitWorks. And they have coaches who'll call you back on and help you motivate and stay engaged.
And they can help you get set up with materials as well to help.
Yeah.
So that's another.
Other ways we can stay healthy is, we try to prevent as many diseases as possible by these lifestyle choices, but then there are other things that we unfortunately can't prevent, and so the best next thing is catching them early, so in terms of,
where primary care is so important, again, to be that first kind of detection of early disease.
So for women, what are some big topics?
So for women, you can kind of break it down by gender and age, and then also other risk factors that are involved too. I think, something that we've talked about and kind of permeated a lot of different subjects is knowing your family history and how that can certainly change. So there's certain screening recommendations that are pretty standard and that, different, vary not so differently, but they can significantly change if you have, a family history of specifically breast cancer, colon cancer, some type of endocrine cancers,
ovarian
cancer, pancreatic cancer, and then other things like kidney disease and so those are things that we joke about, talking about around the Thanksgiving table, but it is,
it is super important towards our own health is kind of predicated in a lot of ways by family history. So for the women watching, I think to simplify it really, if there's ovarian cancer in your family, it's important to tell your doctor about it, because there is a really good argument that some genetic testing should be done. Breast cancer, you want to talk about whether how many different women in the family or men have had it,
bilateral,
if it's more than one breast or not, and certainly it's important to know if young women women in their 30s or 40s have had it in your family. Super important.
Other screening tests for women, Pap smears, we know are wonderful. We had a couple of wonderful midwives on talking about the women's health department here, and so Pap smears are one of the best screening tests that we have, because we have such a good knowledge of the progression of the disease. So we can detect early changes. We can detect the HPV, the virus that is responsible in high-risk strains for causing cervical cancer. And we know that, in the presence of HPV, it takes 10 years to develop into cervical cancer. And that's how we dictate the frequency of screening. And so that, and then we'll talk about later, colonoscopies are really two of the best screening tests that we have, because they can be, we've really nailed down kind of the disease progression of those two illnesses. So, cervical cancer screening with a Pap smear, and just kind of a shout out for, women who have also had hysterectomies or have, maybe over the age of 65 and who have decided to stop screening with Pap smears. An annual pelvic exam is really important to feel for ovaries and uterus, and just make sure there's no pain there as well. And then mammograms.
Yeah,
also.
so we're on the cusp of Breast Cancer Awareness Month,
That's
October.
Right, October, so
yeah.
more to come there. I think there was, we'll plug the Cancer Center a little bit more, but they just had their survivorship program last Sunday, which I know that you've been a part of in the years past.
Yeah, those people who know me in the show, know I'm really passionate about breast cancer. My wife, unfortunately, passed away from it a couple of years ago. So please, get your mammograms. It is, every year or 2 years, starting, you can talk with your physician, whether it's age 40 or 50 or perhaps younger, if there's a family history. And
a lot of insurance companies are also covering a baseline in the 30s without any family history. So if it's something that women are interested in, it may not be yearly until age 40 again, but certainly you can call.
The Southcoast Breast Imaging Center here has the newest, 3D mammograms, which is great for women with dense breasts and younger women, and they just do a really fantastic job of making it convenient, getting results to you timely.
And really, if there is something abnormal, there is a radiologist that speaks with you kind of on site immediately to kind of make a plan moving forward. And I've heard a lot of feedback from women saying that was really kind of calmed their fears, because it can be nerve-wracking if you're going into a screening test like that.
From men is going through to certainly, and women also making sure your cholesterol's checked. Usually by men, unless there's a risk factor by 35, you should definitely know what your your cholesterol is. Women, it's a little bit older, knowing your blood pressure, like we've talked about. Colon cancer screening for men and women, usually starts between 45 and 50. Some of the guidelines are changing. It's important to know. You can talk to your doctors about, or your nurse practitioners about how to screen for colon cancer. There's not just colonoscopies, right? There's some other different ways. There's tests you can do at home. There is of course the colonoscopy. There's some imaging tests. So important, because you won't know the symptoms of early colon cancer. And early colon cancer is very treatable, a lot of diseases, but you won't know. Your stools won't change, you won't have pain. By the time it gets that far, it's usually too late.
And a lot of times I'll hear often, well, I would know. I would know if I was having changes, and the fact is you probably wouldn't know if it's early, like you said. And a colonoscopy is, again, one of those really good screening tests that we have, that if there is a polyp, it's not only diagnostic, but it's a treatment as well.
So they
remove the polyp right then and there during the screening test. And then based on the pathology of the polyp is how frequently you get the next colonoscopy, because we know how it progresses from there. So it really, it's worth it if you want to do it.
Absolutely. And as much as family history is important, we see patients all the time and say, well, there's no family history of that in my family. Family history represents a small part of your risk for cancer, unfortunately. So even though if there's no one in your family who's had colon cancer or breast cancer, you still have a chance of, coming down, succumbing to it. The other thing that we see in our office sometimes is, as the older people get, they think, oh, maybe my cancer risk doesn't, I don't need certain things anymore. And we know with breast cancer, colon cancer, actually, the kind of the older we get, the risk increases. Cervical cancer is one of the rare. At a certain age, we know we can stop.
But Dr. Blanchard, when she was on, I think it's like you said. It's a discussion that you have with your primary care, and if I've said to somebody today, we'll screen you as long as you want to be screened, and
you can tolerate the treatment.
And if we're going to do something about it, then it's always a conversation to have. So it's not so steadfast as just the rules there, the guidelines. So other screening tests that kind of overlap men and women is lung cancer screening. So for people aged 55 to 75 who have smoked at least a 30-pack year history, so that would be a pack of cigarettes a day for 30 years or 2 packs a day for 15 years. We have a wonderful lung cancer screening program at Southcoast with a low-dose CAT scan yearly to detect early kind of changes in your lungs. And that would be for people who have quit smoking or not currently smoking and have quit within the last 15 years.
This is really amazing and new. Over the past several years, lung cancer historically has been really, really hard to diagnose and has unfortunately, killed a lot of people because it's often found in advanced stages. And then we found through these scans that if you catch it early, it's curable through surgery. And Dr. Tammy Gleason, who leads our thoracic surgery program, and if anyone has kind of abnormalities on their chest x-rays or CAT scans or something called pulmonary nodules, we watch them. They have a tremendous protocol and program to kind of keep track and make sure that they're monitored at the right intervals. Because some need to be monitored every 6 months, some
right.
need to be monitored every year, and so we do a really great job of it.
So if you fall into that category, you don't even need a referral. You could call the number. We just give the number out ourselves.
Mm-hmm.
So on the Southcoast website, the lung cancer screening program, if you have a question whether you qualify or not, that's a fantastic program.
So something that's not so straightforward for men is prostate cancer screening. And we didn't have a show on it, but perhaps another date. But we just want to put it out there that men should talk with their providers about whether or not they should have be checked for prostate cancer, because it's a cancer that affects a lot of men, and there's some pros and cons to about finding out early and who should receive treatment or not. So definitely.
And sometimes it's just as a matter of watching it every year, getting hooked up with a urologist, and we have a fantastic urology department. At Southcoast, and they manage a lot of our male patients with the elevated, it's kind of a gray area as to when to start screening and what it means, but we appreciate all of their help in helping manage that. And the other thing, another important screening tests or for people to know about in family history is abdominal aortic aneurysm. I know we talk about that. So generally it's a one-time ultrasound screen, men over the age of 65, and sometimes women if you have some risk factors, and certainly family history on that plays a role as well. So another dinner table conversation there. And
other things that you may have and not know, diabetes certainly. So if you're kind of overweight by age 40, you should ask your doctor if you should be checked for diabetes, or perhaps earlier. That can be done via a blood test. And then, vaccines, are another kind of, component of, keeping well. We're in flu season coming up.
We've got some hot off the press questions about flu here. So I know we had a meeting last night with actually one of our infectious disease doctors who works in our office with us and was a star on the show twice, Dr. Brian Seeley, about the flu vaccine and when to start giving it. So when is the kind of optimal time to get the flu shot?
Yeah, so we were discussing this. So ideally, at the end of October, kind of mid-October, we think is appropriate. But it's safe now. In terms of getting it now. In terms of your convenience, we think between now and the end of October, beginning of November, we'd like everyone to get their flu shots. Certainly, you can get it later, but flu season typically starts. It's a cold weather virus. Starts in December. The vaccine, it's important to know, takes 2 weeks for it to work. So you want to get it ahead of time. So
as a question from Sue, she says, "What's up with the early flu this year, and have you seen any of it in our area?" So, like you just said, hasn't arrived yet that we know of. I haven't seen any. I haven't actually checked the CDC website, but it's a bit early still. I do know from seeing a lot of the sick visits in our office that there is a virus going around with, kind of hits you like a ton of bricks, headache, congestion, kind of mimicking symptoms. But to my knowledge, there hasn't been any flu in our area yet. And then Jody says, it does seem like a lot of symptoms so far this year. Yep, it just happened in the last couple weeks, it seems like.
And then there's also a new shingles vaccine out there we want to make sure people are aware of, called Shingrix. It is, to prevent, the disease shingles, which is kind of the reoccurrence of chickenpox virus when we're adults.
So anyone who's had the chickenpox as a child can get the vaccine, and instead, the previous shingles vaccine was for age 60 and above. Shingrix is now 50 and above, and you can have the Shingrix vaccine even if you've had the zoster vaccine. It just has to be about 8 months afterwards.
And the new vaccine is almost twice as effective as the old vaccine.
And it is a 2-part series also. What we recommend is, first having a discussion with your primary care about whether you'd be eligible, and then we usually send people to the pharmacy and have pretty good effect with people getting them as needed.
Pneumonia vaccines, you can talk to your doctor if it's appropriate or not. There's 2 of those. And of course, tetanus, you can speak to your doctor as well.
About that, yeah. And then in terms of prevention for younger kids, the HPV vaccine, there's some really exciting new data about kind of the possibility of eradicating cervical cancer.
I think this is amazing.
Yeah, so in Australia, they have decided to vaccinate every single school-age child with the HPV vaccine, and they are approaching a 0 cervical cancer rate in the entire country. So that's exciting. And there's also implications for actually throat cancer too, because HPV is a cause of throat cancer as well. So the HPV vaccine is online to be approved actually up to age 40. That hasn't happened yet in terms of the CDC and the approval there. So just keep tuned for those people under the age of 40 who were a little bit too old to get it as, in their younger ages.
Kind of speaking about that and kind of segueing into, so when something happens that we can't prevent, and if so, I think we should lead off with cancer. So I sincerely believe, as you do, we are so lucky to have a world-class cancer centers, right in our neighborhood. In Fairhaven and Fall River, the Southcoast Center for Cancer Care, Dr. Elizabeth Blanchard, Patrick Gagnon, who are the physicians who run it, and the team of people that they have here deliver, the best care locally in our own communities in the most compassionate, kind of healing environments. And so, and I think I lead off with this because people know cancer affected my life. My wife received treatment there, and then at the end in collaboration with Dana-Farber. But it's just an incredible resource to know that we have. You know what I mean? If someone, has cancer, going through cancer, they have navigators. You reach out, you call the numbers, and they'll kind of help walk you through it. I love their motto, like no one does this alone, which is really, really true. And they take care of nearly every cancer that you can think of, in terms of.
So there's the medical side of it, which is the chemotherapy that people think of. There's radiation treatment, which is right in the facilities, and then there's surgical oncologists, which actually physically remove the tumors and could be one, two, or all three.
They work together. They meet regularly. They collaborate. They discuss cases.
Actually, this morning, our office manager was saying that every morning, every member of the team in oncology meets together. Physicians, nurses, medical assistants, everyone in the team. They start their day by meeting together. So I think that kind of sets the tone for how well they work together and what people can expect when they have treatment there.
Yep. And then kind of cancer is the leading cause of death in Massachusetts right now. So it's we have more people living with cancer, but super important to kind of get screened. But if something comes up, to address care, and you don't have to drive far. You don't necessarily have to drive into Boston or Providence, which is getting sick is really. I always say getting to my patients, getting sick is really, really inconvenient. Getting your care shouldn't be. And I think that is actually perhaps kind of the ethos of what Southcoast has built in these communities. Like the leadership cared enough about the community to bring the best here, so you don't have to leave.
So a couple more shout outs. Sorry, JJ said great job, Daddy.
Thanks, pal.
So he's watching. And Kim Rigo says hi, Sue. Jody Souza, just to circle back to the pneumonia vaccines, is asking if the pneumonia vaccines are yearly.
No, they are not yearly, and depending on your age, the interval changes. But not yearly. Yep.
Generally, for average risk people without chronic lung disease or heart disease or immunocompromised, it's age 65.
Yep.
And then a year later for the first vaccine, and then a year later for the second vaccine.
Yeah. People who do have lung disease or are on certain medications to lower their immune system, or if you've lost your spleen, super important. That,
if you have asthma, also as younger.
Yep. Moving on to heart disease, kind of another leading cause of death in the nation, second leading cause of death in Massachusetts. We can't say enough about our cardiovascular center, in terms of helping people kind of get through, diagnose early heart disease. We refer people a lot for risk factors for stress tests and hopefully preventing it, but then in terms of, God forbid, you do suffer a heart attack or an irregular heartbeat with something called an arrhythmia, we have this great team of physicians, nurse practitioners, surgeons to help with that. We had Dr. Nitish Sudan talking about atrial fibrillation, which is one of the most common kind of electrical, problems in the heart that people suffer from, whether it's, if you're feeling palpitations or the sensation you can feel your heart flip-flopping in your chest. Get it addressed, take care of it, because it's important, because it can lead to, a stroke, which is probably the most serious, complication of atrial fibrillation. And he was on, and he was great in terms of helping it, and sometimes you can control through medications, and if we can't, we can control it through some procedures they can do right here, actually, in our lab. Yeah.
In Charlton, yeah.
Yep. They can burn it. Yep. They have a host of ways to fix it.
And also for anybody with so there's electrical problems of the heart, and then there's problems with the arteries, that the blood supply to the heart, but then there's problems with the actual valves that ensure the adequate pumping and kind of what makes you feel good and makes you able to do what you want to do. And so there's a fantastic, valve replacement program with some kind of innovative stuff going on too. So I think that deserves recognition as well, and not having to travel outside of the community.
Talking about world-class care, there's an article in Time Magazine recently about the mitral valve clip and some procedures that people used to have open heart surgery for, replacing their aortic valves, working on their mitral valves, and they do it now through your arms and through catheters. Dr. Adam Saltzman in the Structural Heart Disease Program right in Fall River can do some amazing things in therapy for patients. And Dr. Georgianis, who's the head of the CT surgery, we have so many patients who have had bypass surgery, and it astonishes me how quickly they get them up and walking and out of the hospital and feeling better.
And that being said, we have fantastic cardiac and pulmonary rehab programs as well for those people who have had, heart attacks, who have pulmonary disease, COPD, asthma, and for people who just want to kind of get into better shape to prevent those things as well.
Really important for people watching tonight. If you have emphysema, if you have bad, what they call COPD, or if you have a history of heart disease and you've been treated and you feel like you want to get stronger or not doing great, let us know, because our cardiac and pulmonary rehabs are second to none.
Fantastic,
they really do. They help you exercise. They monitor your safety in a controlled environment, and they improve quality of life. They reduce symptoms, and it's really remarkable. And again, no one doing this alone. It's a team of doctors, nurse practitioners, nutritionists, right? Occupational therapy, kind of working in collaboration. So it's a really great program.
That kind of segues into the vascular surgery program that we also talked about. So a lot of the same principles that keep your heart healthy in terms of a heart attack or stroke also keep the rest of the veins and arteries in your body healthy. So that's controlling blood pressure, controlling the cholesterol, not smoking, and being active. But again, once you do develop disease in terms of your arteries, so there's not enough blood getting to where it needs to go, or in the veins too, and kind of varicose veins that are painful and can be symptomatic, or even some of the more serious things like a blood clot in your veins. We just spoke with Dr. Richard Pinn about kind of some of the options that people have for vascular surgery care here as well.
We didn't have a show on it, but I just want to make sure people are aware of too the signs and symptoms of heart disease and vascular disease. So people often think of chest pain when they think about heart disease, and it's true. A lot of people have chest pain, or an ache, and often it's left-sided. It can be in your arm and your jaw. Pain that you get when you exert yourself, whether you're carrying groceries, you're shoveling,
climbing the stairs.
Climbing the stairs, and it goes away when you rest is concerning. If you get sweaty when you get the pain, it's a bit of a red flag also.
Breath as well.
Yeah, so the other common symptom that sometimes not everyone gets the pain, but shortness of breath that kind of gets worse when you exert yourself, and then there's a relief by rest. Women, we know, historically they studied men years ago in terms of signs and symptoms, so women often can present differently with, kind of heart disease symptoms. So again, more jaw pain, perhaps arm pain. More nausea. So symptoms that come on when you exert yourself and then kind of stop at rest. Don't ignore, really kind of talk to your doctor, get checked out. There's some simple tests whether you can do in the office, EKGs, and our stress tests that can diagnose heart disease early.
And even just talking about your risk too. So we know that if you have a family member who's had a heart attack before the age of 55,
your age in general.
Your age in general, yep. And
above
also
50,
if you have diabetes, because we know that long-standing diabetes everyone thinks of peripheral neuropathy, so kind of pain in your feet, but you can also have a blunting of the nerve sensation around your whole body, and so you may not present in the classic way. So we just reiterate to all of the diabetic patients that if anything new or different in terms of your chest or your pain or any breathing, that it should be.
And when you're seeing your primary care doctor, if you have some risk factors for, cardiovascular disease, if you're diabetic, if your cholesterol is borderline, you should talk to them about possibly ordering a test called the C-reactive protein. There's data out in there that kind of helps you figure out if you're higher risk for heart disease. It's another great kind of tool and that we can help kind of to tell if someone's higher or lower risk in terms of, because some people have higher cholesterol, but their family history and their inflammatory response will be lower. So it helps sort out how aggressive we should be in treating you. Like you said, peripheral vascular disease. If you're walking and your legs hurt, pay attention to it. You know what I mean? So classically,
it gets better when you stop.
Yeah, if you get better when you stop, or if you have wounds that don't heal, it could be a sign there's a blocked, kind of blood vessel in your legs as well. So don't ignore that as well.
We have a question from Lee about one of her parents had, I think it's an EGD procedure, so a scope done to dilate or widen the esophagus, was just sometimes done for esophageal strictures, but their parent is still bringing up some frothy foam saliva. What would you recommend for them to probably...
Yeah, I mean, I think there's probably someone, get in touch with someone who did the procedure or on call for the procedure to make sure. We're not gastroenterologists, and so I don't know necessarily kind of after the procedure what the residual side effects from the procedures. Certainly just make sure there's, God forbid, there's no trouble breathing or swallowing. But if there's such an increase in saliva, there's usually someone on call for every one of our physicians group you can reach out to and call, either if it's after hours or the next day. But I would definitely kind of get that checked out to make sure that it might be normal, but I don't feel comfortable saying it is. I would kind of check in with your gastroenterologist.
So we have some information hot off the press from Dr. Michael Rocha, just reiterating that in terms of prevention, you are leading the Walk with the Doc this weekend, and actually cardiologist, Southcoast cardiologist Dr. Mark Desnoyer is leading the walk on October 6th. And then there are free health screenings with the Southcoast Health van, and those are going to be at the New Bedford Boys and Girls Club from 9 a.m. to 1 p.m. And the next date coming up is October 21st for that. So that's some things you can get there: pneumonia vaccines, tetanus vaccines, flu shots, some more education about STDs, nutrition information, pregnancy testing, kind of referrals for health care, smoking cessation, and just kind of general health information. So we'll see if we can put that up in a link here as well.
Thank you very much. Another great guest that we had on, and one of the reasons why I think we both feel fortunate to practice at Southcoast in this community is in terms of taking care of patients, it's like 15% us and probably 85% the system and the team of doctors around us and nurse practitioners who help us care for our patients. And so another great service that we want to make sure people are aware of is our wound care services. We had Dr. Sanford on, and now we have a wound care center in St. Luke's Hospital and actually in Fall River, and they're amazing in terms of helping people with chronic wounds who can be really debilitating and, trapped in their homes and wounds that don't heal and affect their whole quality of life, and via a whole host of treatment modalities, including hyperbaric oxygen, specialized wound and gauzes. They get people with wounds and they get them healed, and in collaboration with nutrition. And so if you have someone who's suffering from a wound that won't close, or you have a wound that won't close. I
think Dr. Sanford said 2 weeks or over if it's not healing. That's something to think more about.
And if you're a diabetic, or you have a friend or a loved one who's diabetic and they have a foot wound, really, really important not to ignore it, because kind of those can get kind of infected or serious quickly. So really pay close attention to it. I think it's one of the things we try to stress all the time to our patients.
So speaking of wounds, Carly has a question saying that she used to see a dermatologist, but she hasn't been in years. She has some wounds that won't heal. She needs to go back to a dermatologist, but not sure where she should go because she hasn't been in years.
So we have Dr. Eric Dominguez of kind of Southcoast Physicians Group Dermatology in the Truesdale Clinic in Fall River. Fantastic. His team is great.
It's great.
So and on our Find the Doc website you could find him. We refer our patients, and we work closely with him. I actually see him myself personally. And we didn't talk about that, but skin cancer screening is important. So certainly if there's a family history of melanoma or other cancers, it's really important we think to see a dermatologist. And if there's not a family history, if there's a lot of sun exposures, we think it's worth kind of getting checked out for a good skin exam. And
in terms of prevention as well, I know Dr. Blanchard reiterated this, not using tanning beds, sunless
Oh my God,
tanning
yes.
there's been an uptick in melanoma in young women because of sunless tanning, so that's something to avoid.
Yeah, and using sunblock, and sunscreen, absolutely, in the, when you're out in the sun. Moving kind of further down the body, the lungs, right? In our great pulmonary team, we had a great show, right? A couple of them with.
So we were talking about atrial fibrillation. One of the causes can be undiagnosed sleep apnea. And we had a fantastic show with Dr. Kurt Mello, one of the pulmonary doctors intensivists, and he's also sleep medicine, about some of the risk factors for sleep apnea, and also kind of the danger of untreated sleep apnea, which are pretty far-reaching in terms of damage to your heart and damage to other blood
raises
vessels,
your blood pressure, kind of helps your affects your concentration.
So things to look for in terms of if you think you might have sleep apnea that's undiagnosed as snoring. Oftentimes we'll see spouses with the patients come in and just say it's got to stop. It's too much snoring. A large neck circumference,
greater than 17 inches,
greater than 17, and a little bit less for women. Falling asleep while driving, or daytime sleepiness, or waking up from sleep and not feeling rested is a big one. And then just being overweight also, and having high blood pressure are kind of the quick and dirty screens that we do to save somebody. And it actually doesn't always have to look like that. You can be fit and thin and not snore, but just
red flags that kind of bring it up in terms of like a person whose blood pressure just is hard to control. So if your blood pressure is elevated, you're not sure why. People complaining of fatigue, which we see a ton of. It's really kind of digging into, like you said, like when you wake up in the morning, and do you feel rested? And kind of earlier question of that, which we should talk about, which is really making sure that we're getting enough sleep. Most of us, not all of us, need between 7 and 8 hours of sleep at night. And most of us grossly shortchange ourselves in that. There's some people, it's a bell curve, who need less sleep, and there's some people who need more sleep. But for most of us, about 7 hours a night. And so if you're getting if you're going to bed and you're in bed for 7 to 8 hours, and you wake up and you're just wiped out and don't feel rested, like you're nodding off watching television. I have patients who nod off in the waiting room or at red lights, and you're having trouble concentrating. It is. It's really astounding how many patients who we send for sleep studies, wind up coming back and having sleep apnea. And the good news is there's lots of great treatment for it in terms of devices that they can wear, weight loss strategies. And
I think it was another important thing talking about sleep. What we discussed with Dr. Mello is not being able to fall asleep, and that lots of people think that there's quick fix in terms of medications that we give, but it really, in the majority of times, is a behavioral issue. That it's turning the phones off and the blue light off several hours, or at least 2 hours before you go to bed. Avoiding caffeine after noon. And I think that's important for elderly.
Having a set bedtime.
Having a set bedtime and a routine. And then just, for elderly people as well, your metabolism of caffeine slows down as you get older. So people who used to be able to drink that 3 p.m. cup of coffee, that may be the culprit in terms of keeping you up at night as you kind of mature, as I like to call it. A shout out from Tilly saying hi, Hannah and Dr. Podkowa.
Hi, Tilly.
Hi, Tilly. And Kim Rigo said the best thing she ever did was get the sleep test. So that's good to hear. Kind of
asthma,
also,
right?
Asthma, focusing on the lungs still, kind of a different set of diseases is asthma, and as we touched on before, chronic lung diseases such as COPD or emphysema, and a couple of other ones that can really affect your quality of life. So there's some new innovative procedures for asthma that Dr. Beretti is doing, and we had a fantastic show on that as well. But just so things to look for there: coughing, wheezing, shortness of breath with activity. And it's all tied into even seasonal component as well. We're seeing people's seasonal allergies kind of ramp up right now, and I think one of the most important things to know about if you have asthma is waking up at night. Do you wake up at nighttime, with symptoms that you can't breathe, or if you're wheezing at night? That's a really big red flag of poorly controlled asthma. And as I like to, tell patients it's our job we're not doing our job if you're waking up at
if you need
night.
your,
if you need your
inhaler, that
inhaler
rescue inhaler.
more than once or twice a week, we're actually not doing our jobs in terms of kind of escalating the preventative treatment. So that's important for we want to know. You want to know if you're not breathing well or feeling good.
Certainly, and so if certain times of year, if you always get a cough or if it comes back and you haven't been evaluated for asthma, you talk to your doctor about it. Not smoking, super important for anyone with a pulmonary or a lung disease, to making sure you quit, making sure flu pneumonia vaccines are up to date, of course. We are fortunate to have Dr. Mello and his team who do sleep studies. We also are fortunate to have a tremendous team of pulmonologists in all our areas. Right. We have Dr. Eby and the group of physicians who work up in Wareham. We have Dr. Janelle Raphael and Dr. Beretti in Fairhaven, and in the Fall River Market, Terrence McGovern and his group. So anywhere within the Southcoast region, we have great resources in terms of lung physicians that you can see and can help and kind of work with your primary care doctor to kind of help me kind of manage these diseases.
Tilly just brought up another good point, asking if thyroid, either hyper or hypo, so overactive or underactive thyroid, could affect sleeping. And I think that's another important thing to think about if you're not sleeping well, having trouble falling asleep. So your thyroid acts as, I like to describe it as kind of the thermostat for your body. It could either be too low or too high, and there are some crossover in terms of the symptoms there, but in general, if your thyroid is overactive, you may have more trouble sleeping, or underactive, you may be a little bit more sleepy, a little bit of weight gain. Unfortunately, most of the people that come with complaining of weight gain and feeling tired, they have normal thyroids, which is discouraging sometimes. But
kind of speaking of sleep apnea and things that cause it, maybe kind of our next segue into perhaps one of our most popular shows and most interest. We had Dr. Ray Kruger, who is in charge of our bariatric program, who's actually in charge of all surgeons in surgery at Southcoast Health, but has developed the kind of arguably one of the best bariatric programs in the Northeast, and his tremendous success that he's had for people who have had difficult times losing weight, and it was great. And so it's a great resource to talk about, right? Because their inability to lose weight, and we know very little about metabolism and why some people can't lose weight, but we can help them.
Right, and I think it's important to remind people that there's a medical side of the bariatric program as well. So if you need help losing weight, but are not interested in surgery at this point in time, there is a whole team of people within the bariatric program that will help with weight loss.
Dr. Jessica Inwood, who's board certified, in weight loss management, who's just coming on as a great internist, which is really exciting. So it's not necessarily all surgery. There's some new medications that help options, a lot.
And other programs as well.
So for people who are considering weight loss surgery or bariatric surgery, certainly depending on your height and weight, there's different parameters for it. One measure to look at is something called the body mass index, which is a height to weight ratio, and if yours is above 40 or perhaps even 35, depending on if you have certain diseases, that are because of your weight. So those can be sleep apnea, they can be diabetes, high blood pressure,
acid reflux sometimes too. So
it helps it.
And a lot of times, we see it pretty frequently, and it's a wonderful thing that people will come back about a year later after the bariatric surgery, and they're off all of their high blood pressure medications, they're off all of their diabetic medications, and it's
you could argue it's the best treatment for type 2 diabetes.
It is, yeah.
You know what I mean? Like that, it essentially can stop type 2 diabetes in its tracks, and has, and we've seen it.
We see it.
Yeah. And they follow their patients, and their 5-year success rates are excellent. People keep, they lose the weight, they keep the weight off. They do a really, really thorough job of evaluating people before they have the surgery to make sure that they're really prepared for the surgery. Because it's not just the surgery; it really is a lifestyle change.
And there's a lot of support that's required afterwards, and the whole team there is fantastic with that.
Yeah.
So Taylor says Kruger rocks. She's 6 years out of a Roux-en-Y, which is a type of surgery, and she's maintaining, so that's wonderful. We did a follow-up question from Kaylee asking, she went to urgent care years ago and was smoking and found something in her lung, a lymph node, and is wondering what that is. So lymph nodes are part of our system that filters the blood and kind of drains certain fluids, and they can be inflamed for a variety of different reasons, usually with infection, but sometimes for a little bit more concerning reasons. They can react when there's a cancer in the area. So anytime we see a lymph node that, on any type of imaging study that's outside of the normal range, that would definitely be something to follow up on. You could start with your primary care or a pulmonologist, or the thoracic surgery program would be where I'd refer you there, Kaylee.
We're kind of near the end of the hour, so I want to make sure that we mentioned perhaps, I think, one of my favorite guests was on the show. She was actually on before you came on, Hannah.
There was a show before?
There was a show. Okay. I managed on my own for a little
own?
while. Yeah,
okay.
Not great, but I did it.
Look back and see that.
Yeah. Me and Peter. Dr. Holly Alexander was on the show talking about opiate addiction, alcohol addiction, but specifically opiate addiction and the services she offers. And the opiate crisis has affected every community across the United States. The Southcoast is no exception to that at all, and we've actually been pretty hard hit. And I think you're hard pressed to find a family or someone who has not known someone who's known someone who or lost someone from an opiate addiction. And so Holly was on the show. Dr. Holly Alexander is an addiction, as a family medicine physician who actually did additional training in addiction medicine. Her office is in Dartmouth. Dr. Kapaszewski is a new physician who just joined her, also certified in kind of addiction, and is helping her treat patients. And their resources and their passion for treating people with addiction, I think, is like unmatched. Yeah. We refer patients to her and her clinic, and again, no one does this alone. They have a team of counselors and nurses who help people do that. So if you know someone or a loved one who need help, kind of battling, an addiction, please, on our website again, find a doctor, Dr. Holly Alexander. And her team of other doctors who are doing it, and there are other physicians within Southcoast who treat addiction as well, and kind of, Dr. Alexander can help coordinate that. But just an unbelievable service to our community, in terms of, trying to care for, the loved ones who are affected by, this disease.
And she works hard for her patients too.
Oh my God, she's a home run.
Fitting people in, and
she has evening hours. She understands.
Makes it really easy to
non-judgmental. You know what I mean. She just has her whole, the whole team about it. I mean, she taught me in terms of just even the language we use around addiction is wrong. You know what I mean? We use words like clean, and what I mean. We don't say because your blood pressure's high that you're not clean. Right. There's a whole stigma around addiction that just really needs to end. I mean, we need to fundamentally recognize that it is a disease, just as this is cancer, heart disease, diabetes. And so we're lucky to have those services because we know how pervasive the problem is.
So another one of our guests that we had a fabulous show with was Dr. John Stamoulis, talking about strokes and kind of the early warning signs of that, again, in terms of prevention, blood pressure, cholesterol, preventing diabetes, and then just early warning signs. So, any like a terrible headache that comes on quickly, any changes in your vision, changes in your speech, any abnormality in the symmetry of your face, weakness in your arms or legs that doesn't resolve, and the mnemonic is act fast. And this is with the heart, with any kind of tissue that we're talking about, time is brain. So the quicker that you can recognize the symptoms, and it can be confusing, it can be, but the quicker you act and the quicker you get, checked out, the better the chances. And there's some fantastic treatments that can be started to, improve the outcomes, right in the hospitals in our area that, the clot busting medications that are time sensitive. Yeah. So.
I think that's probably the most important message from that is just if you suspect someone may or may not be having a stroke or yourself, don't wait.
Don't wait.
If there's a speech change, all the symptoms you just said.
Don't sleep on it.
Don't go to bed on it. Just don't pass go. Get it checked out. Either call your doctor's office during the day, or if you're at night, go to the emergency department, because we just can't emphasize it enough that we can intervene early in our emergency departments, in our hospitals, in collaboration with some other hospitals. We have great stroke teams to help us.
in keeping with the brain, last week we had an encore presentation from Joe Scott and Kathy Thornton, who are fantastic licensed athletic trainers and the directors of the occupational health program here. And in terms of giving back to their impact on the community and identifying concussions and the treatment of concussions and kind of helping to keep the student athletes safe, and then just kind of general awareness for concussions. Though, I think it's gaining momentum, and those are just fantastic resources in terms of educating everybody on what to look for in terms of head injuries and concussions and things, when to worry.
Yeah.
There.
Kind of wrapping it up in terms of a topic we didn't spend a lot of time on, but pediatrics. We focus mostly on adult topics because you and I take care of adults. But in terms of our pediatric patients, we just want to make sure they're aware of that. In St. Luke's Hospital, in our collaboration with Boston Children's Hospital, we have these tremendous resources for children in our community if and when they get ill and sick in our emergency department. And that, again, true to form for Southcoast, bringing the best care here in collaboration with great partnerships. We have, Boston Children's Hospitals in collaboration with the St. Luke's, ER staff and hospital to care for our own children. And just important to know that if your children are sick, that you can come to, in the St. Luke's area, the Boston Children's physicians are there with our doctors to help take care of them, which is great. So it saves your trip to Boston if you don't need it.
Right. So we're all caught up on questions. My mom is watching. Hi, Mom. So I think, if that kind of wraps up our speed recap. We didn't touch on every guest that we had.
But we want to thank them.
But we want to thank everybody for taking time out of their busy schedules, their Wednesday nights, to just help us highlight the fantastic services that we have in our own community, and just to really keep people at home here as much as we can. I know it's been kind of our privilege to participate in, kind of spreading that message and, touting primary care as much as we can.
There's so many things I loved about doing the show. It really was great. But perhaps, one of them definitely is like sitting with people who really love what they do and just watching them for an hour talk about, what they're passionate about. And, we're lucky to have them. And it's been fun. Hannah and I both want to sincerely thank New Bedford Guide and Southcoast for kind of giving us this opportunity to talk about what we love, which is primary care, and connecting with patients.
Yeah,
if you couldn't tell that we love primary care. It's been a remarkable opportunity, and it's been great to spend time talking about subjects that affect our patients every day, hopefully connecting people with specialists if and when they need them, and kind of lowering the barrier to care, which we think is really important in trying to improving access.
So stay tuned. Or kind of keep the New Bedford Guide and Southcoast Health on your radar for kind of some periodic programming coming up. And,
look forward to some good things coming. We want to thank everyone for the success of the show. I mean, honestly, the people who tuned in and watched and wrote and said thank you, and for the questions. It's been fun. We look forward to kind of next stages and where we're going next. But yeah.
And thanks to Josh, our great producer.
Yeah, our esteemed producer, for making us look good and sound good every week.
Yeah, after clinic. So thank you. Good co-host.
Hannah, thank you.
Sure.
Stay healthy, Southcoast. We'll see you around town.
I started dancing at age 3, and I kept on dancing. I never stopped doing things. I liked to travel. I was walking in Iceland, and it was very painful. Not only are you in pain, but it's the fact that, I don't think I better do this. I could create something that's worse than I have right now. And I really thought, I hope someone will listen to me. And that, I think, is the most important thing. And I was asked, what would you like to be able to do? And I said, I want to be able to do everything. I want to be me. I want to be able to walk. I want to be able to climb. I want to be able to dance. And I want to be able to feel secure. Southcoast listened to me. I felt that it was my decision. I was in control of the situation. I felt a lot better about it. After the procedure, you feel liberated. You feel like you are your own person again. It's a wonderful, wonderful feeling. I've had good care. I've had people to answer all my questions. I feel secure. I had surgery up in Boston at one point in my life. The care that I received here was far superior, and I just felt like I was home. I'm walking with a brand new hip, and it's doing very well, and I feel good. I'm back to where I want to be. There doesn't feel like I have anything that I can't do. When I was at the Jazz Fest and I heard the music and I started and I thought, you know what? I'm dancing again.